Medicine doesn't have to be confusing. Welcome to Dr. Ati classes. Here you find clear explanation. Let's master the medicine together. Dr. Ati is back again. Let's learn appendicitis together under 2 minutes in this class. First of all, we see that Dr. Ati looks very distressed and she putting her hand on her abdomen to show us that she may have abdominal pain. So Dr. Ati comes to the emergency department with the abdominal pain around the umbilical area, which gradually radiates to the right lower quadrant, meaning the lower right part of the abdomen. Then we start to examine her. We see that Dr. Ati have fever. We see the thermometer next to her forehead to show that the fever can be seen in appendicitis patient. On the bed next to her leg, we place the white blood cell count of 18,000 to show you that the leukocytosis is also seen in appendicitis. When you take the history of Dr. Ati, she said that she has nausea and vomiting. That's why we place the suction container next to her leg so that whenever she wants to vomit, it's available. After we taking the history of Dr. Ati, then we move to physical examination. You see written on the board near to her legs that her bone tenderness and tenderness are positive. What does this exactly mean? It means when you press on the abdomen in the right lower quadrant, Dr. Ati feels pain, and when you suddenly remove your hand, the bone tenderness, she feels severe pain. At the top right of the image here, we can see an exam where the patient has pain in the right lower quadrant, but when you press on the lower left side of the abdomen, the patient feels pain in the right lower quadrant. This is called Rovsing sign. The middle picture describes as the psoriasis sign, which means when you lay the patient on his side and extend his right leg backward, he feels pain in the right lower quadrant. And finally, in the last picture, you can see the obturator sign, which means that the patient in the supine position, you flex the hip and rotate the leg internally. And again, the patient feels pain in the right lower quadrant. That was all for today. Thank you.